Hey, what's up everyone? Good afternoon. We are back for Wellness Wednesday number 8. So today we are going to talk about imaging, and if we do that in the office, why we do it or why we don't do it, okay? First off, an announcement that I want to give you guys is that if you're in the area, you probably saw that Williamson County is requiring masks to be in public or at public businesses. We are actually just south of that line and we're in Murray County. So you are not required to wear a mask to come into our office for treatment. If you do want to wear a mask, if you feel more comfortable doing that, absolutely. Make yourself comfortable. We're doing all the necessary steps here to make sure everything is clean so you guys can be safe here. Okay, so now we're getting into the topic, a little bit of controversy with this one, but we're going to talk about imaging and do you actually need it? Okay, more specifically with imaging x-rays. Okay, so x-rays are a good tool in the right hands and at the right time. Okay, so here at our office, we don't have x-rays here. We actually send them out if they're needed. Okay, the reason why we don't take imaging or x-rays on the first visit is because they're not necessarily reliable or can relate or correlate to what you have going on. Okay, so we have our intake form, we have our history that we take, we have all these different steps necessary to kind of figure out what's going on with your body and then to rule out any of the scary stuff that might need that further imaging. Okay, so what's kind of crummy is that x-rays, like I said, do not correlate to what's going on with your body. So if we sent you off for an x-ray and you have, let's say, neck pain, okay, we could send you off for that and you could come back and after that image, you could not have any findings present that kind of lead us to that neck pain or is that cause that neck pain. Or conversely, you could have the most beautiful x-ray, sorry, I just said that. You could have the worst looking x-ray, just a lot of bone spurs, different things that could be causing that, and then you could not have any symptoms at all. Okay, so there's not really any good correlation between what you're feeling, the symptoms you're feeling, and what's shown on imaging. So they had a big study with MRI, and now MRI is not the same as X-ray. It's a lot more detailed though. You can see different tissues, they can weight it differently so you can see the different fluids and the pressure changes, more of the bony stuff. Okay, so with this, they actually found with a massive study that people with C-spine disc herniations, 87% of them on imaging had the disc herniation, but of that 87%, about 1,200 people did not have any pain at all. Okay, now we bring it down to the low back with just disc degeneration, okay? So the group that was studied had the MRI done, 80% of them had disc degeneration, but over 3,000 of them didn't have pain. Okay, I'm gonna post a little infographic that'll show you guys this information, but it's, just kind of leads to my point that it's not always necessary to have that imaging. And like I said, we're taking the history in here. We're doing all the necessary things possible, because if you do, or if there is a red flag that comes up, then absolutely we're going to get the imaging to make sure that something else isn't going on to where you need to be seen by someone else that may be more suited for your case. Okay, the American Chiropractic Association, who kind of governs chiropractic, there's another one called the International Chiropractic Association, but they come out with a Choose Wisely campaign that kind of gave us some guidelines with imaging for patients. And the two ones that they come up with for imaging is that imaging is not necessary in the acute phase of care if they have no red flags present, and it's within 6 weeks. Okay, so we're gonna do everything we can to avoid the imaging, try conservative trial of care, so then we don't have to necessarily waste our time with getting the imaging for your back when it could not even tell us anything. Okay, like I said, the red flags are there. We're taking the history. If there's just something fishy that is coming up, then absolutely, we'll send you for the x-ray, but we're not using that to bring you into care and to read, to understand how we're treating your case, because a lot of times it doesn't really give us any change in direction with that imaging, just because that correlation that doesn't really exist with that. Then the second one with that is no routine x-ray procedures, just to monitor how treatment is going. Okay, so x-rays are just a snapshot of the spine, a 2D image, how it's shown in that one time. We're not able to really see much for change with that, because there's so many variables that go into taking an x-ray, body position, your breathing, things like that, so we can't really tell if it's changing how we're doing. What we're looking for in office, and that's not shown on the imaging, is how you're moving and your pain levels with that. Okay, so we know that as we get you moving, as we get those muscles functioning properly, the brain more aware, and telling your body that it's more safe to provide those movements, that's what's going to predict your outcome and your good outcome with care, rather than what's shown on the picture. Okay, so we're not using that to drive you into care. We don't need that to see where to adjust, where to treat, because we're doing a really good history, we're doing a really good exam, and then we're palpating and adjusting the areas that need help. Okay, so another thing with that disc degeneration that you see, okay, we don't want to use that as a scare tactic, because if you have that disc degeneration, if you have a little bit of spurring, a little bit of that arthritis, that is completely normal. Like I said, it doesn't correlate to that. That just means that you've used your body or you haven't used your body. Okay, so we always say that arthritis shown on imaging, or arthritis in your joints, is just like wrinkles on the skin. Okay, it just means you're using your body, you're getting older. It just comes with age. That A word that we don't like to use, because it's just not an excuse that we want to run to, because we believe that everyone can move to their ability. Okay, so that's really what I wanted to talk about with x-rays. I know some people are going to disagree, some people will agree. Great, there's controversy with everything, but that's kind of our standing here. We don't need that x-ray, but like I said, if we do need to kind of figure out what more is going on, if there's some red flags, then absolutely we'll send you out. Just know that you're not your image. We're in here to change your function, get you moving, and get you healthier so you can move without pain. Okay, so that's all I wanted to talk about with the x-ray talk. Hope you all enjoyed it. And like I said, if you want to get scheduled for a new patient visit, we won't take imaging unless necessary. If you know anyone that wants to get in with care, maybe they have a little bit of aches and pains or anything going on, send them in. We'd love to treat them. Okay, so our last thing, July is our Facebook review month. So all of our patients, current, past, future, anyone's been treated by Dr. Hawkins or myself, we're asking for some Facebook reviews, so just we can get our name out in the community and we can help more people get out of pain and move better. Okay, so that's just a great way to kind of promote our office and let more people know about the services that we can provide to help them. Okay, so if you've been with us, leave us a Facebook review, please. We definitely appreciate it. It doesn't even have to be about the docs. It's about the girls up front. They do such hard work to make sure everything flows perfectly. So with that, I'm going to take off. I'll post that infographic with all of the MRI imaging, kind of the correlation thing. And just know that you may not need x-rays, and we'll definitely figure out if you do or not. Okay, everyone, have a great Wednesday, and we will see you next week, okay?